Welcome. This is an instructional video designed to teach the correct self-injection technique and support people who have been prescribed Luveris. There are a few steps to follow when using Luveris. This video will show you each of these steps in detail. Please review all of the steps first before starting to use your medication. If you have questions about your injection after watching this video, please talk to your healthcare provider. There are also other resources available to help you. They include Momentum, a free and confidential phone service that offers support including injection assistance for patients who are prescribed EMD Serono fertility products. Momentum offers services in English, French, and 250 other languages through certified interpreters. Your fertility clinic nurse, doctor, or pharmacist can also provide further information and guidance. Always follow the instructions they gave you on how to use your medication. Remember, this medication is for single use and has been prescribed for you only, so please don't let anyone else use it. Self-injection may seem a little difficult at first, but many people just like you have been through this treatment before, so you're not alone. This video will teach you how to self-inject in 4 steps. Number 1, getting ready. 2, preparing the medication. 3, preparing the injection site. And 4, injecting the medication. How to use Luveris. Getting ready. Okay, let's get started. Before you begin, clean your work surface and wash your hands well with soap and water. It is important that your hands and the items you use are as clean as possible. On a clean work surface, like a clean table, lay out everything you will need: 1 vial of Luveris, white powder, and 1 vial of diluent, clear liquid, 1 syringe with a long needle attached for mixing the medication, 1 short needle for the injection, alcohol wipes, and a sharps disposal container that your pharmacy or clinic may have provided you. Preparing the medication. Opening and drawing up the diluent from the vial. Pick up the vial of diluent, which is the clear liquid used to mix the medication. Remove the plastic protective cap. Using one of the alcohol wipes, clean the top of the vial. Use a circular motion starting at the center of the rubber stopper and then wiping outwards to the aluminum ring. When you are done, discard the alcohol wipe. Next, remove the syringe with a long mixing needle attached from the package. Carefully remove the cover of the mixing needle by pulling it straight off of the needle. Take care not to let the needle touch anything. Pull the plunger back on the syringe until it is at the line showing the amount of diluent that you need to draw up. In this example, we are using 1 cc. Placing the vial on a clean, flat surface, push the needle through the center of the rubber stopper on the vial. Push slowly down on the plunger. This will inject all of the air into the vial of diluent. Keeping the needle in the rubber stopper, lift the vial and turn it upside down. Keeping the needle tip completely covered in the liquid, slowly pull back on the plunger until you see the required amount of diluent in the syringe. In this case, we are using 1 cc. Remove the needle from the vial. Carefully replace the cap on the needle. Be sure to follow the techniques suggested by your nurse or pharmacist to help prevent pricking yourself with the needle. Place the syringe on your clean surface. Discard the vial containing any unused diluent into the disposal container. Mixing the medication for injection. Pick up the vial of powder, which is the medication. Remove the plastic protective cap. Using an alcohol wipe, clean the top of the vial. Use a circular motion starting in the center of the rubber stopper and then wipe the aluminum ring. When you are done, discard the alcohol wipe. Pick up the syringe containing the diluent and carefully remove the cap off of the mixing needle by pulling it straight off of the needle. Placing the vial on the clean, flat surface, push the needle through the center of the rubber stopper on the vial. Push slowly down on the plunger. This will inject all of the diluent into the vial of powder. Leaving the needle in the vial, gently rotate the vial between your fingers until the powder is all dissolved. Check to ensure that the solution is clear and colorless. Do not use the medication if it is cloudy, discolored, or contains particles. Drawing up the medication. After the powder has dissolved, keeping the needle in the rubber stopper, lift the vial and turn it upside down. Keeping the needle tip in the liquid, slowly pull the plunger back all the way until you have all of the medication in the syringe. Be careful not to pull the plunger out of the syringe. It may also help to slowly tip the vial so that the needle remains in the liquid. Remove the needle from the vial. Discard the empty vial into the disposal container. Changing the needle. Carefully replace the cap on the long needle and set it on your clean work surface. Open the package that contains the small, short needle for injection and place it on your clean work surface. Pick up the long needle and syringe and holding it with the needle pointing upwards, create a small air space at the top of the syringe by gently pulling back on the plunger. Then twist the long needle off to remove it. Pick up the small, short injection needle and twist it onto the syringe of medication. You may discard the long mixing needle in your disposal container. Holding the syringe with the short needle pointing upwards, gently tap the syringe so that any air bubbles rise to the top. Now, just very gently push the plunger upwards until you see a small droplet of medication at the tip of the needle. Do not worry if you are not able to remove all of the tiny air bubbles. They will not harm you. Replace the cap on the short injection needle and place the syringe on your clean surface. Preparing the injection site. Your healthcare provider has suggested a location on your body where you can inject your medication. This is usually in the upper thigh or the abdomen. Be sure to choose a different site each day. Wipe the injection area on your skin with an alcohol wipe, cleaning an area of about 5 by 5 centimeters, about the size of a tea bag, using a circular motion. Allow your skin to dry. Lay the used side of the alcohol swab next to your working area or on the alcohol swab wrapper. Injecting the medication. You are now ready for the injection. Pick up the syringe and carefully remove the needle cap by pulling it straight off from the needle. Hold the syringe like you would a pencil, using the hand that you would write with. With your other hand, gently squeeze the skin together to make a little raised area at the injection site. Using a dart-like motion, insert the needle at a 90-degree angle into your skin. You need very little force, but quick action. Inject the medication by gently pushing on the plunger with your thumb, as shown here, or your index finger. Take as much time as you need to inject all of the medication. As you release the skin from your grasp, you can remove the needle from your skin by pulling it straight out. Use the clean side of the alcohol wipe that you have set to the side to gently clean the injection site. If there is minor oozing, you may need to apply a small amount of pressure on your injection site for a few seconds. Disposal of all used items. Once you have finished your injection, immediately discard the needles and syringe into the disposal container that your clinic may have provided you. You do not need to recap the injection needle for disposal. If you have questions about your injection following this video, please talk to your healthcare provider or call Momentum toll-free at 1-800-387-8479. Also, please consult the consumer information leaflet in your product package for detailed injection instructions and important safety information.